Cancer screening tests. Cancer screening tests aim to find cancer before it causes symptoms and when it may be easier to treat successfully. An effective screening test is one that finds cancer early, reduces the chance that someone who is screened regularly will die from the cancer, and has more potential benefits than harms. Mammography is the most common screening test for breast cancer. A mammogram is a picture of the inside of the breast. Mammography may find tumors that are too small to feel. It may also find ductal carcinoma in situ, in which abnormal cells line the breast duct, and in some women may become invasive cancer. Screening mammography has been shown to reduce deaths from breast cancer among women ages 40 to 74, especially those ages 50 to 69. Mammography is less likely to find breast tumors in women with dense breast tissue. Because both tumors and dense breast tissue appear white on a mammogram, it can be harder to find a tumor when there is dense breast tissue. Younger women are more likely to have dense breast tissue. It is important to note that all women, including those with dense breasts, should be screened starting at age 40. Magnetic resonance imaging, MRI, may be used to screen women who have a high risk of breast cancer. Cervical cancer screening. Human papillomavirus tests and Pap tests are recommended cervical cancer screening tests that can be used alone or in combination. The human papillomavirus test checks cells for infection with high-risk HPV types that can cause cervical cancer. The Pap test, also called a Pap smear or cervical cytology, collects cervical cells so they can be checked for changes caused by HPV that may, if left untreated, turn into cervical cancer. It can find precancerous cells and cervical cancer cells. Expert groups generally recommend that testing begin at age 21 and end at age 65. If you are in 21-29 years age group, United States Preventive Services Task Force recommends getting your first Pap test at age 21, followed by Pap testing every 3 years. If you are in 30-65 years age group, United States Preventive Services Task Force recommends getting screened for cervical cancer using one of the following methods: HPV test every 5 years, HPV Pap co-test every 5 years, Pap test every 3 years. Updated cervical cancer screening guidelines from American Cancer Society recommend starting screening at age 25 with an HPV test and having HPV testing every 5 years through age 65. However, testing with an HPV Pap co-test every 5 years or with a Pap test every 3 years is still acceptable. Colorectal cancer screening. Both polyps and colorectal cancers can bleed, and stool tests check for tiny amounts of blood in feces that cannot be seen visually. Guaiac FOBT is stool test uses a chemical to detect heme, a component of the blood protein hemoglobin. Randomized trials have shown that GFOBT, when performed every 1 to 2 years in people aged 50 to 80 years, can help reduce the number of deaths due to colorectal cancer. In colonoscopy test, the rectum and entire colon are examined using a colonoscope, a flexible lighted tube with a lens for viewing and a tool for removing tissue. The colonoscope is inserted through the anus into the rectum and the colon as air is pumped into the colon to expand it so the doctor can see the colon lining more clearly. During colonoscopy, any abnormal growths in the entire colon and the rectum can be removed. A meta-analysis of 6 observational studies reported that screening with colonoscopy substantially reduces the risks of developing and dying from colorectal cancer. Experts recommend colonoscopy every 10 years for people at average risk as long as their test results are negative. Lung cancer screening. Low-dose helical computed tomography, a type of CT scan, has been shown to reduce lung cancer deaths among heavy smokers. Expert groups generally recommend screening of some current or former heavy smokers at ages 50 to 80.